Hepatitis A. Hepatitis A is a disease of the liver. It's caused by the hepatitis A virus. Your liver is the largest organ inside your body. It sits under your right rib cage. The liver has many important roles. It filters harmful chemicals from your blood. It helps you fight infections. And it helps you digest your food. It stores nutrients, vitamins, and energy. If your liver gets infected by the virus, it becomes inflamed. Inflammation is the body's response to an injury or infection. Hepatitis A can make you feel very sick for a few weeks, but it does not often cause long-term liver disease. How you might get hepatitis A. The hepatitis A virus can get into your body through food or water that has been in contact with the feces or stool of a person with the virus. Hepatitis A is one of the most common types of illness that is spread through contaminated food and water. It is most common in countries that do not have clean drinking water. You can also get the disease if you have been in contact with the feces of a person who has the virus. You could be at risk if you travel to a country that does not have clean drinking water, live with a person who has hepatitis A, use illegal drugs, are a man who has sex with men, have a clotting factor disorder, have oral or anal sex with someone who has hepatitis A. Signs and symptoms. After you are infected with hepatitis A, it may take 2 to 4 weeks before you start to feel symptoms. Children under age 6 may have no symptoms. Older children and adults may feel like they have the flu. Signs and symptoms may include fever, being very tired, upset stomach, nausea, vomiting, loss of appetite, dark-colored urine, joint pain, or yellow-colored eyes or skin called jaundice. Diagnosis and treatment. Your doctor may be able to tell you have hepatitis A based on your symptoms. He or she will also have you do a blood test. The test looks at certain proteins in the blood called antibodies. Your body makes more of these proteins when it responds to an infection. A blood test may also be done to see if the virus is hurting your liver. The symptoms of hepatitis A usually go away in a few weeks. If you get diagnosed soon after you're infected, your doctor may give you a medicine called immune globulin. This can help prevent you from having symptoms. Get lots of rest while you're sick. Don't drink alcohol until you are well. In the future, your body will be able to fight off another infection of hepatitis A. But you could still get other types of hepatitis. Prevention. You can get a hepatitis A vaccine. A vaccine teaches your body how to fight off a virus. This is called immunization. It takes 2 injections of the hepatitis vaccine to prevent infection. Children should have the vaccine after their first birthday. Some adults should also have the vaccine. These include adults who are at risk for hepatitis A or have another liver disease. It is also a good idea to have the vaccine before going to a country where hepatitis A is very common. What you can do. Ask your doctor about the hepatitis A vaccine if you may be at risk. Let your doctor know if you have been exposed to hepatitis A or have symptoms of the virus. Always wash your hands after going to the bathroom or changing a diaper. Always wash your hands before preparing food. Be careful if you are in an area where hepatitis A is common. Don't eat undercooked food. Use bottled water for drinking, ice cubes, and cooking foods. Use bottled water for washing off fruits and vegetables. What we have learned. Hepatitis A is a disease of the liver. True or false? The answer is true. It is caused by the hepatitis A virus. One way you can get hepatitis A is by drinking water that has been in contact with feces from an infected person. True or false? The answer is true. You can also get it through contaminated food. There is no vaccine to prevent hepatitis A. True or false? The answer is false. You need 2 injections of the vaccine to keep you from getting infected.